Hello and welcome to this member-led, Q-led event entitled Building Culture, an Appreciative, Safe and Caring Framework. My name's Gemma Crossingham and I am the Learning from Excellence SIG convener, and it's my absolute pleasure to be chairing today's session. Now, I imagine many of you are already familiar with the concept of appreciative inquiry and the transformational and positive impact that it can have. But for those of you with less experience, welcome, and do not worry. Appreciative inquiry is a beautifully simple and effective tool that you can rapidly adopt into your everyday practice. But in summary, appreciative inquiry is a strengths-based approach which can facilitate rapid, positive organisational change and, importantly, growth. But today you don't need to take my word for it, because we are very lucky to have some experts from across the industry who are going to share their stories, their wisdom and their experience. They include Suzanne Quinney, Daniel Hodgkiss and Kaylee Barnett, who are all co-authors of a newly released book entitled Appreciating Health and Care, which I'm sure they will share with you today. It's an absolutely fantastic resource, and I would strongly recommend getting yourself a copy. But without any further ado, I will now hand over to Dan, and we look forward to inviting some questions and having a lively discussion at the end of the session. Thank you, Dan.
Thanks, Gemma, for the intro. I'm just going to share slides and hand straight to Kylie. So Kylie's going to kick us off.
Thanks, Dan. So just while we're waiting for those slides to come up, as Dan said, I'm Kaylee. I'm one of the authors on Appreciating Health and Care, along with Dan, Suzanne, and people from Aqua, as well as from Health Innovation West Midlands. So we're here to talk to you today a little bit about the book, and a little bit about some experiences, some case studies from that book as well. So just to give you a slight overview, there are two kind of resources available. One is the Appreciating Health and Care book, and the other is an AI in practice. So it's a case study book with a number of different case studies in there as well. So they're kind of complementary resources that really support each other. And there's some information on where you can access those a little bit later on as well. So the book has been created by Appreciating People, Health Innovation West Midlands and Aqua. So I'm involved because I used to work at Aqua, and retained my authorship because I stamped my feet a lot when I left Aqua and said I desperately still wanted to be involved. So I was lucky enough to still kind of maintain a really close connection to the book even after I moved on from Aqua. So if I can have the next slide, Dan, please. So just a very, very quick overview of what is appreciative inquiry. Not to go into any of the details, but appreciative inquiry, it's kind of two words, and obviously the word appreciative comes from the idea that when we focus on something, we increase it in value. It appreciates. You hear about kind of finances appreciating. It's exactly the same thing in this context. The more we focus on something, the more that we value it, the more it appreciates and grows. And inquiry is that process of seeking to understand through questions, and the value of paying attention to processes and people. And in the terms of appreciative inquiry, what we're doing is bringing those two things together. So we are focusing on the really good things and asking questions about what's going really well and how can we grow that further? How can we get more of that? And I often say, you can only have 100% of anything. So if we're seeing more and more of the positive stuff, then by definition, that means that we're getting hopefully less of the negative as well. And it's about, as it says on the slides, they're really combining our heart and mind at work, bringing in that kind of emotional connection to our work that we all feel and we all know that we feel, and supporting that really positive heart set in our working environments. Next slide, Dan, please. There's a couple of really easy ways that we can use that appreciative lens to get us started and to get us going. So the first one of those is working from strengths. So finding what are our strengths, strength spotting in others, and kind of getting people to work on pieces that really speak to their strengths. And that doesn't mean that we don't recognize where we've got development requirements, but it's about assigning work and giving people jobs related to the strengths, rather than expecting people to be in a place of kind of not working from their strengths. And journaling and reflection can really help you to recognize your own strengths as well. So where are the parts of your job where you really excel, whether that's soft skills or hard skills, which are the bits that really kind of make your joy at work sing. Um, Another great way and a really, really impactful way that we can do that is by beginning team meetings with appreciative check-ins. So rather than saying what's happened this week, talk about what's gone really well this week. What's a sparkling moment that's happened for you this week? What's been the highlight of your week? And starting team meetings with that sets the tone for the rest of the team meeting. And it's genuinely one of the most powerful, really, really small interventions that you can do to completely change the tone of the meeting. I thoroughly recommend giving that a go. And you can also end with something that you've enjoyed or learned during that meeting as well. A really great way of bringing the team together to share experiences of that specific meeting. Next slide, Dan, please. So just a very, very brief overview of where the book actually came from, how it came about. So it first emerged following a conversation at the World Appreciative Inquiry Conference way back in 2009 in Nice. I wasn't a part of that, unfortunately. I did not get to go to that conference. But Aqua and myself came in around about a year later, just before COVID kicked off. And that period has given us a real time to get our heads together, to work with practitioners in appreciative inquiry, quality improvement, human factors, to really collate a selection of case studies that demonstrate practical application of appreciative inquiry within health and social care, to demonstrate the importance and the impact of that. And also to get some really, really rich case studies that are included in the book and in the accompanying guide as well. So just a whistle-stop tour of where it came from. Next slide. And I think I'm handing over to you here, aren't I, Dan?
You are indeed. So in terms of what you can expect from the book, it's been cited that this is the world first of its kind. So it's the first lens of a resource that brings together human factors, appreciative inquiry, and quality improvement. And that's really quite nice, because actually one of the things that we have seen traditionally in healthcare is that we try to use some of these methodologies or approaches in isolation. And actually, when we use them together, we get something much more rich. So this resource really brings together all of those movements, approaches, methodologies, etc. And it really tries to look at how we shape our lens in health and care. So there wasn't much narrative actually in the world around using appreciative inquiry in health and care settings. So actually this was, as a notion, we're really, really blessed that actually we're progressing well with the use of appreciative inquiry, with quality improvement academies and the Q community, etc. Now, we're one of the first nations that are really embracing this. And we only have to look at the patient safety strategy from 2019. It was the first strategy of its kind that asked us to shape our lens by using strength-based asset approaches like appreciative inquiry. So the book has 23 case studies. And they're from a mix of health and care settings across the country. And it's really nice on the call today to see a few of the other case study authors like Ruth. So thank you for joining us on the call. That's really nice. And I think in terms of the themes, so we tried to theme down the case study work so that it sort of matched like sort of key areas. And these really match to how we perceive we can use the resource much wider. So the first is about how we start to improve that engagement, those conversations, those relationships that we have. And in appreciative inquiry, anyone that knows about appreciative inquiry, it's about people. It's about interaction and connection to people. So those relationships become absolutely critical to what we want to achieve. Second is how we work together, and whether that be formal teams or informal teams. Actually, what does that look like? What does the systems view look like? And that link into human factors as a lens, but equally, what sort of conversations do we have? Thinking then about our well-being and our culture. And we know that we work from a lens of traditional healthcare being quite deficit-based at times and quite traumatic for some people, whether that be staff or patients. So actually, how do we come together for our own well-being as staff, but equally for the well-being of our patients and the people that we serve and our communities? And how do we embrace that culture? So we hear much more now in terms of safety, the root of positive safety cultures, and actually that's reflective of using these sorts of asset-based approaches in our work. Equally, how do we become resilient? And we've probably all heard the term post-traumatic stress disorder, but actually appreciative inquiry and the resource will ask us to deepen our thinking, to look at growth. So the mindset of growth and moving forwards. So not just, bypassing the negative, absolutely thinking about what is going wrong, where can we improve, and then where do we grow? So there's a whole section on growth. And then that sort of person-centered care, thinking about you as an individual, how can you use this, not just in your work life, but in your home life, so that you use this throughout your whole being, that spirit of wholeness, which we'll come on to. Patient safety, my background is in patient safety, so I absolutely see the lens of how we can use appreciative inquiry and this resource in that patient safety sphere. And we see with Peace Surf, it's the first of its kind that really moves us to look at learning and improvement. And we're going to hear more around that in the case studies today. But equally, ourselves taking a lead on our improvement and our involvement in our sort of health and care settings. So those themes center around the whole of the resources in both. But if we move forwards, what we deepen our thinking into the resources that actually we look at a number of the appreciative tools that might be useful to you in your workplace. So one of those, so the first on the left of the slide in the top left is what we call the 5Ds. And that's really the core model of appreciative inquiry. And it's one that was used in lots of other industries. It's a little bit akin to the PDSI model. So it is an improvement cycle, but it asks us to really open ourselves up to challenging what we can achieve. What's that dream that we want to get to? And how do we sort of shape our destiny to get there? Equally, the SOAR. So you could see one of the key notions of appreciative inquiry is the use of reframe. And I think the SOAR is one of the best reframes we've seen. So you've all probably seen a SWOT analysis, and you've all probably tended to, in doing a SWOT, gone straight to weaknesses and threats, and actually really not considered your own strengths. How many of us know what we're good at? And in doing that, whereas leaders, how do we know what our teams are good at? And how do we really shape our teams to work to that strengths? So the SOAR is a reframed version of a SWOT analysis, but absolutely much more about growth. Equally, at the bottom left, we see the work here around safety 1 and safety 2. And this is absolutely critical. You've probably all seen this bell curve many times, that in healthcare, we focus on that 10% of unwanted outcomes, incidents, serious incidents, complaints, coroner's inquests, all of this. But actually, we know that's 10%. So where do we focus our energy on the 90% where it's going well or better? And actually, how do we learn from that? Those positive surprises, how do we bring that in? And we're going to hear that throughout both the case studies. And then equally on the bottom right, thinking about that resilience. How do we move from despair to hope? So all of these tools we're seeing used quite a lot now within health and care settings. So we wanted to bring this together and showcase what we're doing. And so I think the book is a real collection of a showcase of stories and examples of how you can get involved. And if you haven't already, there's case studies that are sort of quite transformational system-based projects, but there's equally smaller teams using this in their day-to-day, so anyone can pick up the resource. And what we equally see is that challenge around patient safety now. So we've probably, if you're in the patient safety sphere, you've probably heard of SEEPs and, that notion of the human factor model, thinking around systems. Actually, one of the key component parts of appreciative inquiry is the principle of wholeness. How do we connect together? And actually, the quote at the bottom left, everything is connected. The whole is greater than the sum of its parts. And nothing is more true in our work in health and care settings, that we all come together when we look at that sort of internal environment, the people within our environment, the tools that we're using, the tasks. Actually, if we all work together on that, the organization absolutely becomes much more versed in improvement and learning. So thinking through that system, then moving to our processes and our outcomes, appreciative inquiry really helps us discover what's going on in our system. understanding the people within that system. So it accompanies human factors, but equally gives us that sort of predetermined understanding of what are people thinking, what are people doing in our systems, how can we connect together better, and equally, how can we co-design improvement? And I think that's what we really want to do. You know, improvement comes from all areas, whether that's bottom up or top down. Actually, the beauty of appreciative inquiry is that anyone can do it. So, in terms of the opportunities that arise from the resource, the first, I think, is that we can absolutely start to embed some of this. You know, we've seen examples of this used in lots of settings, but how do we embed it? How does this become part of our everyday language within health and care settings across the country? You know, PSERF is a good example, as I've already cited, but how do we make sure that PSERF doesn't become SIF 2.0? Because the serious incident framework absolutely wanted learning and improvement. What we got was something quite different, a lack of learning, if you like, and a lack of improvement. You know, so it's up to us to understand that real cultural underpinning to patient safety and PSERF to get that right. It's equally thinking through our approaches and our methodologies at local, sort of regional and national level. How does this become part of our delivery? So one of the things that we're working as a team since the resource was launched is we're working closely with the patient safety team nationally, that this resource underpins the strategy and becomes that sort of underpinning focus, underpinning principles that support us in patient safety and doing patient safety differently. DECA talked about patient safety differently many, many years ago, and actually now we're starting to embrace that. The second is around NHS impact. NHS impact, brilliant for giving us that opportunity as a whole system across healthcare to think through improvement and what quality improvement looks like. But actually, if we underpin that then with appreciative inquiry and human factors and bring all that together, we get an absolute much strengthened view in terms of improvement. And we're equally meeting with the culture and transformation team nationally so that this becomes part of our people's plan and it becomes embedded into everything that we do in the NHS and equally in social care. So we're working with CQC and the Scottish Inspectorate to how they work to inspect and regulate. We see with the new CQC single assessment framework that actually CQC have come out recently and said that they need to improve, that they need to change that methodology and approach. You know, that's really honest and open of them. And actually something we want to expect is that we work closer with the inspectorate bodies so that they understand more about our work. And then there's more opportunity for us to shine and embrace that. I think actually what's here and what's really nice to see is the number of people on the call and the real want for this information is brilliant, because actually that's a community in itself, and it's how do we sustain and improve that community, keep the community conversations going? How do we support you locally within your own teams to go and have a go at this? Because there's no right or wrong with this. But when you start doing it, you absolutely start to see something really beautiful emerge. Okay, so then in terms of where you can get copies, and we'll go through this more at the end, but obviously all three of the websites listed on here have access to those resources. It was a real partnership approach. And I think actually when you look at this, three partners from across the country in different fields all coming together, working on something for the benefit of the whole of health and care is really quite nice. So I think the challenge for you guys then is how can you use that resource then to build on it, to add the case studies to the future? You know, we've talked about 27 case studies in the books, etc. How do you create the next 27 or the next 50 or the next 100? So that would be my challenge from this. But that's probably enough from me in terms of the resource. But what we did see is that numerous case studies, we were flooded with people when we set out a request for work in this field. So we're going to share a couple of those with you now. And obviously, as we move forward with more of these webinars, we'll share more of them. But I'm going to invite Katie Fisher to come and join us now. Katie can introduce herself. I mean, she's doing some brilliant work, and you know, she has a podcast at the minute, which I'm hopeful that she'll talk about. And if you haven't heard, absolutely go and have a listen because it's brilliant, and I can't echo enough the work that she's doing locally. But Katie, if you'd like to introduce yourself and take over.
Yeah, of course. Thank you. So I'm Katie Fisher. I am a nurse. I've been a nurse for nearly 20 years now. I'm a mum, and I also was a head of clinical governance in the heart of a COVID pandemic in a deficit-based approach acute trust. And I am now a regional senior nurse across the Greater Manchester region. So through the trenches, background into the NHS, and been born into a deficit-based approach. So didn't know any different. So especially in clinical governance, it's built around what has gone wrong, what do we need to fix, and then focusing on finding that harm. Now, we do need to focus on finding that harm, but when you look for it, you will always find it. So when I was a head of clinical governance, I started to look at ways in which I could protect the well-being of my clinical governance team, because you see so much sensitive and distressing information coming through the doors, especially if you're doing it right, because you're trying to promote a reporting culture, and instant after instant after instant, with potentially no overarching learning, just a cattle market, really. So looking into that, and actually being lucky enough to work with Kaylee in my trust at that time, I started to look at what I'd called it was looking for the good. And Kaylee told me, thank goodness, that it was Appreciative Inquiry as well, which is exciting. So I was trying to look for the good, but I did it very much on the sideline of clinical governance until I started to really read into safety too. And completely agree with one of the participants that have put in the chat that it should be seen as an organisational development structure as safety too, and not just a framework. Once you start to build in appreciative inquiry into clinical governance structures, patient safety structures, and also the way you talk to people and the way you get the best out of people, it completely opens up your mindset of what can be possible. So the case studies that I put into the book, there's two, and actually I talk about this on the podcast, that there's two pathways that potentially you'd want to focus on, is the way that we talk to people and the way that we ask questions and how we inquire, and also how we can build that into structures moving forward. So one of the case studies was in the heart of a pandemic, we'd had a really hard weekend, patients on the corridor. I was the head of clinical governance for a medicine division, A&E, 12 wards, mortuary, phlebotomy, really heavy going. And we had a debrief meeting on the Monday with the medical director. And the medical director immediately started to say, can we just talk about the weekend and what happened and what went wrong? So people immediately started to think, right, what went wrong? And started to list the things that went wrong. So as a head of clinical governance, I could tell that actually there's been minimal incidents of harm over that weekend, considering the issues that they were facing throughout that weekend, considering the patients that were on the corridor, considering the patients that were delayed in getting medications. So I asked if we could, within this debrief, talk about potentially what went well as well, because there must have been something that everyone did as a team to start to keep those patients at least as safe as possible. And when people started to think in that way, and we started to break it down, that interview style and that questioning, people started to talk about multidisciplinary working, pastoral care for both staff and patients, the palliative care team coming in to those patients and making sure that they were comfortable and safe. Lots of different areas where we can learn from what was working well. And that was just from a conversation and just a bit of courage to try and turn that ship of that deficit-based approach. So around the same time, the other case study was around the same time we had a critical incident in the A&E department. It was called for around 5 days. And we did see harm incidents around those 5 days. And the exec team wanted to call a STICE investigation on the critical incident. Now, we do say in Appreciative Inquiry that words create worlds. And I knew if they went seeking the harm and nothing else, that would be seen as an A&E department that was causing harm and nothing else. So I asked for one bit in the terms of reference to that investigation to add what went well. in that situation. So I built an audit process, and within the audit process, there was one line that said what went well, that was a mandatory field, and you couldn't get past it. So you had to look for what went well in that situation. Very vague question with an open content box, but interestingly, different things came from different people. And I was hoping, really against hope, that we could get maybe 2 appreciative inquiries out of it, that we could then look at the individuals that had brought amazing care to those patients. What we found was over 20 appreciative inquiry examples, and we found much, much more of examples of patients that became well and then went home, which is what the big unspoken is, what we say on the podcast. The great unspoken is when you have given care and treatment and those patients have improved and gone home, or given care and treatment and those patients' conditions have improved in whatever way, shape or form. You don't talk about it. And then because you don't talk about it, it's not celebrated and it's not learned from. So from that STICE investigation, we were able to have around 6 formal appreciative inquiries looking at examples like a patient coming in with terminal cancer who came in and got amazing anticipatory medication within the first 4 minutes of arrival, then was seen by a palliative care team within the next 20 minutes and was in hospice an hour and a half later in the heart of a COVID pandemic in the middle of an A&E department. Now, that would never have been recognised or realised or talked about because that A&E department don't talk about those things, but they would have only been seen as a harmful department. So those are 2 of the case studies that I thought were just day-to-day me looking for the good, but they were put in a book. So I knew there's more. I know there's more in the NHS and health and care as a whole. So that's why I thought it was important to start a podcast, to start to talk to other people about what they're doing in health and care. And just watching these people talk about the good that they found and the way that they've turned things around is amazing to see and to hear. And it's addictive. People then go, oh, I can do that. The whole premise of the podcast was to hear, to be accessible to all and for everyone to hear, oh, I can do that. Or I've been doing that. I just didn't know it was called Appreciative Inquiry. So, and that's the power of it, because it is a mindset and a philosophy and a social movement rather than yet another framework or a couple of structures or bullet points. It is a mindset and it does bring about the best in people. So I love it. I'm addicted to it.
Thank you so much, Katie, for sharing. I think it's absolutely brilliant the work you're doing, and it's just great to be connected with you through the resource and then wider actually now. I think it's just brilliant. And I think one of the things that I take away, we'll have some chance for questions at the end, so I'm going to move us on to Vicky in a minute. But 2 of the great things that you talk about there is courage. I often talk about braveness, that real curiosity. And I think uncertainty and braveness creates curiosity and creates improvement. But it's having that boldness and that braveness at times to say, actually, let's challenge the way we've always done this, because actually we're seeking better. And we owe it to ourselves and our patients to have better actually at times. And I think the other that you said is that great unspoken, that to me, there is so much already there of good examples of this kind of work, but we just don't hear enough of it. And hopefully the resources, the platforms that we're doing and linking in with national teams and local teams, etc., to make these shifts, that we hear far more of these stories, because they're so impressive when you hear it, but actually it's a shame not to hear them.
Yeah, the other thing I really want to quickly chuck in is that STICE investigation and the audit creating appreciative inquiry found the same learning from what went well as what went wrong. So it mirrored.
Absolutely.
So the learning was, say, multidisciplinary working or a fast escalation of deteriorating patients, or the same learning came out of it. So there's much more that can be done about a potential appreciative governance model and how we can build that in.
And I couldn't agree more. So one of the positive deviant acts that I created when I was in patient safety was something called right cause analysis. So we used a 5D model to completely change our RCI point. I know we're not doing RCIs now, but actually Right cause analysis used the 5D model to look at an inquiry. And it again found, similar to you, that we found similar outcomes of what we would term in a normal RCI to what we did in the improvement, and actually much greater, because we found things of strength that we didn't know about. And that's, I think it adds value in a much greater sense. So thanks, Katie, but we'll absolutely ask some more questions to you in a minute, I'm sure. I'm going to hand over now to Vicky. So Vicky's equally from the Health Innovation Network. And Vicky, if you want to introduce yourself, but Vicky leads our system safety work.
Thanks, Dan. Thanks very much indeed. So hi, I hope you can hear me okay. Thanks for having me to the session today. As Dan said, I'm the programme lead for the System Safety Improvement Programme for the West Midlands, and that means that I'm responsible for supporting PSIRF. If you're able to share my first slide, Dan, if you don't mind. So what I'd like to do with you today is share some of my reflections of using appreciative inquiry in my work. So some of my reflections of using it in my work when supporting integrated care systems, because I work across the whole of the West Midlands. So therefore I work with a lot of PSIRF leads, both in integrated care boards and with provider organisations. And I'm here to support them in their PSIRF preparation and implementation. Next slide, please. I'm sure many of you are familiar with the incident response framework, or PSIRF, which is much easier to refer it to as. For those that are not, it's a new framework, and Dan mentioned before that it's not SIF 2.0, it's not intended to be. It is a new framework, and it sets out the NHS's approach for responding to patient safety incidents. But the key to PSIRF is that it's for the purpose of learning and improving due to patient safety incidents, and that's really the key. And I put a little quote from Black Country Healthcare, who's one of the organisations that we work with there, which is one of their reflections in a sentence that has come from them. But PSIRF isn't just a framework, and we've heard that already today as well. And what underpins it, its essence, is what's really, really important. That need for that cultural shift, that cultural change, with transformation of practices, increased collaboration and partnership working, and reduced silos. Next slide, please, Dan. So I think Einstein is often attributed to have said that everything that can be counted doesn't necessarily count, and everything that counts cannot necessarily be counted. And that really relates to patient safety, because when we think about incidents, it's more than just the quantitative data. So changing that culture and that behaviour is about sharing those stories, and we can really do that using appreciative inquiry. To have that inquiring mind, to problem sense, to really think, what it is that bothers us, what's coming out from our gut. When we think about our work and our interactions as part of that system, and Dania referred to human factors in that, and that's really, really important in part of that. So therefore, we're able to gain a deeper and more meaningful understanding of safety within patient care. And we're able to gather intelligence of what goes wrong, but importantly, as well as what goes well. And we've heard about that today. And it's about opening our eyes and our ears and giving attention to what our worldview of incident management perhaps is. Are we challenging ourselves around that, about what we think about that? And to think about the positive areas of our work, and that are sometimes perhaps lost or maybe not fully included in our considerations and future actions. Next slide, Dan, please. So, of course, with a big strategic organisational change across the whole of England that PSIRF is, there's going to be the need for production of plans, policies and procedures, absolutely. But implementation of PSIRF cannot be achieved by policy alone. It really is a change of hearts and minds across the organisation at all levels. And using appreciative inquiry with our PSIRF leads from, as I said before, the ICBs and provider organisations has enabled PSIRF preparation and implementation to be reflective, even aspirational. It's been really collaborative, and it's given a real positive momentum to the challenge of significant organisational change. So how have we gone about this? And I talked about this in the case study. So we've used, and I continue to use, appreciative inquiry in all areas of my work, be it through the facilitation of a SAW exercise in a workshop, for example, where we're able to discover and design processes, plans and procedures, but also to develop those real generative questions to help support thinking around the guidance documentation, but through that appreciative lens. Next slide, please, Dan. So I'm just put on here some of the questions that I've used as part of the workshops when I've done SOAR exercises, both at regional level and at local level, and asked people really to think about, with PSIF, we're not throwing away everything. There is some really, really good stuff that's gone before, but we want to build upon what the good is. We want to look at that asset-based approach and ask us what we're proud of, what already works really, really well, what's going on that's really, really great that we can take forward in this. Because often we think with a new framework, well, that's all gone before and we'll just start afresh. But no, there's some really great stuff already happening. So we're reframing that. And some of the questions there has helped us to consider that. Next slide, please, Dan. And when we're thinking about our aspirations and resources as part of those SOAR conversations, we ask PSIRF leads and operational leads and anybody involved in patient safety to really think, well, what does a positive patient safety culture look like? What does it feel like to work in that kind of environment? How would I feel working in an environment like that? And how do we spread that? Or what does it need? How do I create that? Then let's be aspirational towards that. To ask ourselves, what does good look like? But really mean that through what it's like for our staff, for our patients, for our organisation. And will it still look that good in 2 years? Or are we just doing this right now? How are we going to sustain and embed that going into the future? Next slide, please. So these were some of the fabulous responses. And this was way back when we started with PSIRF, right way back at the beginning, when one person turned around to me and said, I've got absolutely nothing to write on this. And I said to her, I've just seen you do the most fantastic presentation about what you see your system looking like in the future. Of course you've got loads to write down. And she kind of looked at me. And then she asked me for another piece of paper 10 minutes later because it was full, because the energy in the room and the conversations that were taking place and the collaboration across the tables was really, really fantastic. And interestingly, we also repeated one of these exercises with our ICB leads. So we did it with the ICB leads as part of a regional work. And then we took it back to their individual ICS and said, OK, let's get your provider organisations to do this as groups. And she said, yeah. And I said, well, no, you're doing it as well, aren't you? And they said, no, we've done it. We've done it. And I said, well, SOAR helps you move forwards. It's a part of a journey to help you build upon what's gone before, and implementing PSIRF is a journey. So let's have a try, and it might be different. And actually this lovely lady came rushing over to me about half an hour later and she went, it is different and it's better. And we've done loads and we've moved on. So we were like, yeah, that's fantastic. So the energy in the room, it's you know, these things are intangible sometimes. You've just got to kind of have a go and have a try. And I think that's what I've really learned as part of doing this as well, is that, you know, put your assumptions to the side and have a try, because it's really, really helpful. So next slide, please, Dan. So again, I go to perhaps another sticky issue that we've approached through using Appreciative Inquiry, which is oversight, governance and assurance. And sometimes that takes us to a different place in our own mindset when we think about assurance, when we think about those areas of governance, but it doesn't need to. And actually within the PSIRF documentation, there are some fantastic mindset principles that were actually created by you with one of the human factors specialists who thought about this. So we sat down as a group, and Dan and I sat down and thought about this as well. And we thought about, how do we look at some of the questions that we ask of our providers and our boards and say, well, let's reframe it. Let's think about those questions that we're asking ourselves, but through an appreciative lens. And actually each one of those mindset principles, those questions there relate exactly to that. They're just very, very slightly different, and it just gets you in that different headspace. So all of that has really generated that thinking, that reflection and that discussion. And if you could jump to the next slide for me, please. We also thought about, well, okay, we've done some preparation and we're talking about those sticky wicket issues around governance and assurance perhaps. But what PSIRF really wants us to do is think about system learning and improvement, because that's its main aim. So again, going back to the SOAR of strengths, opportunities, aspirations and resources, we thought about, you know, looking at it through a lens of curiosity, compassion, to enable us to think about, well, how do we work together as a system? Have we always challenged, or can we challenge ourselves to not think about working in silos? Do we know the team that works down the corridor? Do we speak to the hospital within our own system about similar challenges that we have? Or are we still kind of heads down and looking at these issues separately? And through that lens of curiosity and compassion, we're enabled to present some of those shared challenges, and there was real openness in the room and that sense of psychological safety, which is absolutely critical to this mutual compassion. And it encouraged everybody to come together as a system. It connected an understanding of common challenges, as well as an appreciation of each other's challenges and each other's opportunities, which we may be able to come together and help each other. But it also really creates an alignment of strengths, and that's where we can move from appreciative inquiry. Next slide, please. So we use this to articulate what we want to use for our forums within certain provider organisations and systems to move forward. And appreciative inquiry is a foundation of those conversations now moving forward, which is really, really brilliant. Throughout all of this, we still remind ourselves of the essence of PSIRF and the principles of what PSIRF aims to achieve. And this is just some feedback that I've had from a couple of systems when they've done this work around insight and oversight, which again, as I said before, can be quite challenging. And as you can see there's some really, really positive actions and positive elements of that. There's no empty boxes there, which is really great to see. And what they're also doing is taking that back to their organisations and using that as a foundation to move forward themselves. This isn't an exercise in isolation. Next slide, please. Just quickly, with reflecting about transitioning into PSIRF, sometimes it's really, really good to stop and just think about where you are. It's a bit like learning to drive. Once you're driving, you forget what it was like to learn. And I think when you're doing this big organisational change, sometimes it's good to just take stock of what were the positive surprises, I think I heard someone say before, and what went really, really well. Because times are tough and things get hard and we lose the momentum sometimes. So sometimes it's really good to take stock of this. And we did some generative questions around that. And we keep reminding ourselves of that as we go through this journey. Next slide, please. So the journey so far of supporting PSIRF implementation, as you can see in the top right-hand corner there, we did have some quite negative feelings when we first said, okay, PSIRF, how does it feel for you? Another big organisational change. What's it like working in this area? And there was a lot of negativity. But we asked them what it wants to look like. And we got these wonderful words of psychological safety and positive safety culture and no blame and brave and bold, which is what we've heard today. And we talk about sharing of minds, the language that we use, coming together with psychological safety, the use of appreciative inquiry tools, and all of this work in PSIRF, there is a golden thread of appreciative inquiry that we use for that through the West Midlands. And I just wanted to share this because this is a slide I use a lot to remind people of just how far they've come. Next slide, please. On a personal level, I'm a radiographer. I've worked in the NHS for the last 30 years, but I'm relatively new to appreciative inquiry. It was only really coming to work with Dan and colleagues in health innovation that I kind of knew more about it. I'd heard of it, which makes me quite sad, really, seeing as I've worked as an oncology radiographer for all of that time. And so I feel it's really opened my eyes up to the positive ways of looking at things. I think I was very, very deficit-based before, and I'll just be really honest about that. And I went to a workshop with Suzanne in Blackpool, and this is from the book. And we had a fantastic time doing arts and crafts, in all honesty, but the picture on the left-hand side was a different team that was in the room, and they'd started to put together what they thought was appreciating what they had. And I stood sort of at the side and I looked at that and I thought, well, that just looks like an ecosystem. That looks at how mutually dependent and interconnected we all are and the importance of that and nurturing and growing what's positive. And so they took that away, and I'm really pleased to say they've now called it their Team Eco Garden, and Suzanne was lovely to share that with me. So I was really, really pleased to see that. So that was just a personal reflection from me, and I feel really blessed that appreciative inquiry is now part of my working life and my personal life. So next slide, please. So thank you everyone for listening.
Thank you very much, Vicky. I think that's really helpful actually as well. And much like Katie, that lens of safety in our work. And for me, one of the sort of two things that stand out there, reflections, that not everything that we've done is rubbish and we have to throw it away. We have to build from strength. So there's lots of things we're already doing that we just need to nurture. And I think that comes into your second point, which is the ecosystem. And there's a little bit in the book around regenerative farming. And people might ask, why are we putting about regenerative farming in a book about health and care? Well, actually, I challenge us all to understand that notion of regenerative safety or regenerative healthcare systems. And I think that's what you've talked about, that ecosystem of coming together, connecting, absolutely the essence of appreciative inquiry. But equally, then, how do we support the new generations coming through? How do we support people that are the laggards to this? You know, that are really quite fearful, that they want to move towards something bold and new and be brave and curious. You know, so actually, how do we support that whole community in a different way? And I think that's a real sort of challenge, and it's something that you, Vicky, are doing in our region. It's certainly something I'm trying to do with the managing deterioration work. I mean, if I just look and think around deterioration, the whole word is negative, but actually we've done something really quite special as a result of managing deterioration across the country now, and we're moving into real use of those national safety programs now being underpinned by appreciative inquiry, positive safety cultures, quality improvement, and human factors. And I think, you know, as we move forwards, that's brilliant. I really enjoy being part of the space that we're in at the minute. I think there's a real opportunity and first for us to want even more and to challenge for more in this space, because it's right to do so. But with that in mind, I'm conscious of the time, so I'm going to now open it up to some questions. What I would equally like to say is thank our host Gemma as well, because, you know, Gemma is paving the way for lots of people. So, you know, the power of praise as one of your blogs, Gemma, you know, the LFE community, and you lead the STIG within the Q community for this piece of work. And if people haven't already seen those, you know, we've referenced them within the book, but have a look at Gemma's blogs, because there's some real impressive work about how you're really challenging us to move not just into the excellence space, but then when we're in excellence, what do we do with it? You know, and how do we use it and how do we sustain it so that becomes norm? And I think that's really, you know, special that we're all trying to do that collectively. So I think we're blessed in this forum to have lots of, you know, mindsets that are probably shared, if I'm honest, that the fact that you're all here and wanting to know about this. And I can see from the chat, I put in my book a flurry of messages, and it was some real great conversations actually, which I'm really happy with. So I'm going to hand to Gemma to kind of lead us through that sort of question session. But I think everyone, you know, on the panel's open to those questions if we want to hear more. And I didn't get to see the chat during your presentation, Vicky, so there might be some questions that have come through, or people want to raise their hands, etc.
Well, thank you, Dan, and all of your team. What an inspiring hour that was. So it's just fantastic to hear some of the theory, but as I say, the real application of this, because sometimes it can just feel sort of very theory based. But now hearing these stories, hopefully, will inspire some of you to think that you can actually take some meaningful steps and, you know, promote growth professionally and personally. So has anyone got any questions, or shall I kick off? There's one question that I've got that I have thought about and for a long time, so I'd welcome any suggestions or ideas. What we've found through Learning from Excellence and the appreciative inquiries that have come on the back of the Learning from Excellence nominations often relate to behaviours. So people don't often talk about, you know, fantastic processes. It's more that people did things, or that they'd made, you know, were positive deviants. What I then struggle with, and I'm constantly seeking sort of enlightenment with, is once you define these positive behaviours, how can you spread positive behaviour? I know that's a massive question, but it is something that I constantly think about. I don't know if anyone else has got any ideas, thoughts, or examples of where they've been able to grow that positive behavior, that sort of the human element of positivity.
So if I come in first and then others feel free to join. And I think the first thing that I would say is that we start working with the willing. So there's probably a whole host of people within your trust, within your groups, etc., networks, that are wanting this change equally. So it's finding them, and it won't be hard to find those people, if I'm honest. And I'll just cite a story that was part of my working life, a little bit like Casey. I started, my NHS career in a acute community trust. I got there, and the trust were rated as inadequate, and governance was non-existent. I'd gone into the patient safety manager role, so I was looking at serious incidents, and it felt like I was just looking at the same incidents week in, week out. And actually, I was just like, this cannot be right. We're not learning. We're not improving. So I thought, right, actually, let's completely readdress the balance. And we started, I think it's equally starting in small teams. So one of the very first things that we did in our environment was with the patient safety and governance team, we started to really challenge ourselves as a team before we shared this wider. What does this look like? What's the opportunity here? We did a bit of a saw. We used appreciative tools. We had walls of appreciation and trees of gratitude that we put up in our sort of team. And we equally had sort of on a Friday, we would have 11s. And this was really important. And it's that notion that Vicky said about taking that time to stop and reflect. We had cake and we had tea and whatever. And people would say, oh, well, you're not working. Well, actually, some of the best improvement ideas that I've ever had the team came from those 11s, because people felt safe enough to speak up. And they'd probably had these ideas for a while, but didn't air them. So when they felt comfortable and relaxed, actually, they were much more about sharing and learning. One of the first changes that we did, so we got safety huddles that weren't quite effective. I said there's a real opportunity for a divisional safety huddle. All of our teams are free, so the lead nurse, the lead clinician, etc., to come together with our ops teams and look at incidents, look at learning from excellence, look at all of these great things together in a half-hour huddle. And the divisional medical director at that point said, I can't be dealing with this fluffy stuff. It's not going to work. I'm not going to attend. So the lead nurse said, well, I'm up for this and I will go. And she came, and it was a brilliant session. And he stood outside the room. And at the end, he took the lead nurse aside and he says, how rubbish was that then? And she says, it wasn't. It was brilliant. She says, it was actually probably the best meeting I've had in a long time in this trust, because we did things differently. And we started the conversation and we ended the conversation really differently. And Dan challenged us actually with some questions that I just think in a very different way. In week 2, he sat in the room but didn't speak. And then in week 3, he chaired it. And when CQC came to us, they said that our governance had moved from inadequate to outstanding within 18 months. We had the biggest laggard that was championing our work to the CQC. So we work with the willing first. And then you slowly start to change minds, because they have their similar mindset, similar behaviors. More people will see that change being elicited. So then they move towards the laggards going, oh, actually, it piques an interest for them, because actually you're starting to show outcomes. In terms of our outcomes, we reduced serious incidents by 42%, repeat serious incidents. Now, we were the second highest trust in terms of incident reporting nationally. So equally, we'd moved to more of the sort of no harm, near miss reporting, really learning from before we cause harm, to that extent. And we'd won a sort of national HSJ award for completely changing our culture. Our CQC changed, but actually patients and staff were much, much happier. We got patients involved in QI projects as part of incident, improvements. And I think one thing what I often say around safety is that, we've action planned, whereas now it's about time for planning for improvement. And that's a subtle reframe. But actually, if we do that, we plan for improvement and we bring people on board with that improvement journey. We don't bombard people in one go. So we launched this in stages. We didn't do it across the whole trust in one go. And then by the end of this, we had a wall of appreciation at the very front atrium of our trust, where every single team every month would give one thing that they've done really well from that month. What a positive change for our patients to come in and see, and our families to see when they're coming into our trust, that they see a whole wall dedicated to strength and improvement and positivity. when normally they would probably go on a ward and say, oh, this is our latest serious incidents, this is our latest, you know, infection control breaches, etc., completely flipping the lens. So I think that's where I would go. I can see Katie's hands up on that. So Katie, bring you in.
Yeah, so that it is interlinked from what you were saying. So linking to Civility Saves Lives work, and I know that we've all worked alongside Civility Saves Lives, and I love their work as well. Looking at it between positive behaviours and negative behaviours isn't necessarily the way to go. And I think probably the wholeness principle, looking at actually, you know, no one thinks that they are portraying negative behaviours. They all think that they're trying to provide the best care or service that they can in health and care, but actually, where are they coming from? And why are they acting in that way, or what do they feel they are achieving by acting in that way? And also allowing that opportunity for them to hear the different priorities and viewpoints in the room builds that strengths-based approach as well. So actually, you know, Appreciative Inquiry gives that opportunity for those individuals to hear an alternative way or a better way, building on what they've already tried to build on, but portrayed in a different way. So it's seeing everyone in the room and all of those priorities, and it's really powerful. But I do think there's a lot of really interesting work in Civility Saves Lives that then builds into learning from excellence and appreciative inquiry to then move forward in an organisational development strategy. It's really powerful stuff.
Thank you so much for sharing all of that. It's just really inspiring and helpful as well. So thank you. Has anybody else got any questions? They can just speak up. Or any questions from the chat? Put your question in the chat if you'd like to. We've all got enough information to digest and think upon, reflect upon. I can't see any more. Any other questions? Any afterthoughts or? No? Okay. Well, it is 1 o'clock, so we've actually run perfectly to time. So just leaves me now to thank the wonderful contributors today. As I say, just a fantastic session. You can see the feedback in the chat is in agreement with me there. So thank you very much. Just going forward, as I say, if I think there is a link to the book, a really, really valuable resource. And the other thing is to say that we're going to be running some more, probably 2 more sessions related to this topic, one in September, and then one probably, I can't remember the date, Yoriam, that we said it was going to be, but after that, but on this concept of building an appreciative culture with some more specific focuses that we will advertise. So please join us for those following sessions and also share with your friends. And it would be lovely to stay in touch with you all. Please join the Learning from Excellence SIG, and I know there is also discussion about starting an Appreciative Inquiry SIG as well, so it'd be great. We will obviously be referencing that as well and working quite closely together. So thank you all for joining us. It's been a pleasure, and we'll see you after the summer.